Director of the CDC says a breach in protocol led to her exposure and diagnosis and warns others could have been exposed as well. We asked doctors here in Austin about the proper way to treat an Ebola patient to keep everyone safe. KXAN's Angie Bevan has the story.
CDC Director Dr. Tom Frieden says the nurse who's contracted Ebola provided extensive care to the initial patient. They don't yet know what went wrong.
The protocols work. We have decades of experience caring for patients with Ebola, but we know that even a single lapse or breach, inadvertent, can result in infection.
As they investigate how the nurse contracted the disease, they're also taking into consideration that others who cared for Mr. Duncan could have experienced the same mishap.
It is possible in the coming days that we will see additional cases of Ebola.
Dr. Frieden says the CDC wants to enhance protocols for doctors and nurses who treat Ebola patients. For instance, they're recommending keeping the number of caretakers who have contact with an infected person to an absolute minimum. They're also reevaluating the protective clothing and equipment they wear. Last week, the emergency department medical director at UMC Brackenridge in Austin showed KXAN what healthcare workers do put on when treating a patient with an infectious disease.
This is a gown that it's paper, but it's impervious.
It provides full barrier protection. They also put on a face mask with an eye shield.
And then my gloves. And with the gloves on and all of this on, I'm pretty much as protected as anybody needs to be.
He says they also put on shoe covers. Then you take everything off before leaving the room, ball it up, and throw it away. In Austin, Angie Bevan, KXAN News.
After learning the nurse in Dallas tested positive for Ebola, the CDC and investigators started assessing people she had contact with after she got sick. They say to their knowledge there is only one person that needs to be monitored.